While there are many dementia subtypes, we will focus on 4 more common clinical syndromes. Alzheimer's disease is characterised by short-term memory loss and language difficulties, followed by longer-term memory loss, behavioural changes, loss of cognitive skills, poor judgment, and progressive loss of function and independence. It usually commences after the age of 65 and is due to brain structure damage caused by protein deposits in the brain. The cause of the protein deposition remains unknown. In some instances, Alzheimer's disease is known to run in families. This is more commonly seen in Alzheimer's disease that begins at an early age. Lewy body dementia usually occurs in people aged over 75. It is due to clumps of protein called Lewy bodies accumulating in the brain and causing decline in brain function. This form of dementia involves often unpredictable changes in levels of thinking, speech, attention, alertness, and confusion. Affected people experience visual hallucinations, sleep disturbances, and movement problems that mimic Parkinson's disease, including stiffness, shuffling and slow movements, tremor, and susceptibility to falls. Frontotemporal dementia is a rarer form of dementia, but this type is more likely to affect younger people in their 50s and 60s. The protein deposits in this dementia build up in the front and side parts of the brain. Up to 1/3 of frontotemporal dementia is found to run in families. Symptoms due to frontal brain damage include problems with planning, impulse control, social behaviour, problem solving, and flexible thinking. It also affects personality, empathy, awareness that their condition is occurring, and can cause general apathy or disinterest in life. The temporal symptoms affect speech, both understanding speech and using words correctly, and vision, so that recognizing objects and faces becomes impaired. Vascular dementia remains a controversial diagnosis because the majority of people who have strokes do not develop dementia, and many people with vascular dementia have never had a stroke. The diagnosis is made when vascular disease is the predominant explanation behind symptoms of progressive cognitive decline. This means that damage from multiple very small strokes is the cause of the cognitive change. Symptoms include problems with memory, flexible thinking, impulse control, slowed processing of information and retrieving information. Vascular dementia responds better to prompting and reminders for memory than Alzheimer's disease.